Turning now to your community focus, while investigators are still looking into what led a mother in Duxbury to allegedly kill her own children before trying to take her own life, this horrific incident has sparked a conversation about maternal mental health.
And joining us to talk about postpartum depression and what you can do if you need help is Dr. Emily Miller, the Division Director of Maternal Fetal Medicine at Women and Infants Hospital. Thanks so much for being here.
Thanks for having me.
So first off, Dr. Miller, can you just walk us through the signs and symptoms of postpartum depression and tell us when women are most at risk?
Absolutely. So postpartum depression typically manifests as having a depressed mood, feeling down or blue most days, or just not enjoying day-to-day stuff that you normally would enjoy. Along with another constellation of symptoms. If these are starting to impair your functioning or your daily life, then it's time to reach out for help.
And when are women most at risk of developing postpartum depression? I read somewhere that up to a year after the baby is born.
Yeah, you're exactly right that postpartum depression, the psychiatric manual says that it will happen within 4 weeks after delivery, but most experts, myself included, think that it can manifest up to a year postpartum. I think what's also really important to note is it doesn't have to happen postpartum. We now know that most people with what we used to call postpartum depression actually have an onset of their symptoms during pregnancy.
Now, there are levels of postpartum depression, and that includes an extremely severe form called postpartum psychosis. Could you explain exactly what that is and who is at risk for that?
Absolutely. So postpartum psychosis is incredibly rare. Happens about 1 out of every 1,000 postpartum people. We tend to see this manifest in the first few weeks after delivery. And what we're starting to think is that this is a manifestation of either new onset bipolar disorder or undertreated bipolar disorder.
And Dr. Miller, I can say from my own experience, I know I've been screened regularly for postpartum depression since I gave birth 8 months ago, but it's usually just a paper form at the doctor's office. And I'm curious if you think this is the most effective way to sort of open up a conversation with women about how they're really feeling.
Yeah, it's such an important thing. I think there's a lot of health services research going on right now to see what's the best way to begin that conversation. I think the most important thing is that conversation begins. So I think having more culturally sensitive or more updated screens, beginning instead of just handing someone a form with a conversation that opens the door to having someone answer honestly are all really important tenets of having that conversation be fruitful.
And what types of resources are available for not only new moms, but maybe their family and loved ones if they find that maybe something just isn't feeling right or seems wrong?
Yeah, so incredibly important. So first and foremost, all obstetric clinicians, OBs, midwives, family medicine docs, nurse practitioners are equipped and have resources. So if you start to feel unwell, not yourself, something is different, please reach out because we can help. For providers, there is here in Rhode Island, Mom's PRN program, which is a psychiatric access program. So again, those obstetric providers can reach out and get expert perinatal psychiatry consultation on the phone to be able to help or link their patients to care. And then, of course, important for all of us to know about the National Moms Helpline 8339 Help for Moms, or of course the National Suicide or Crisis Hotline 988.
And we will put that information on our website as well. Dr. Emily Miller from Women and Infants Hospital, thank you so much.
Thanks for having me.